Welcome to the Defeating Epilepsy Foundation YouTube channel. In this presentation, we will discuss depression in teens with epilepsy, the impact of depression, diagnosis, symptoms, risk, and treatment options. Make sure to like our videos and subscribe to our YouTube channel. Click on the bell to be notified of future videos. Please click on our donate link in the description section below and donate today. Your donation helps us to make a difference for those battling epilepsy. We appreciate your support. According to Mayo Clinic, depression is a mood disorder that causes a persistent feeling of sadness and loss of interest. According to the CDC, the following behaviors are seen in children who are battling depression: separation anxiety, having a fear of a specific thing or situation, being afraid to go to school or places where there are people, worried about the future and bad things happening, repeated episodes of intense fear resulting in symptoms such as heart pounding, trouble breathing, feeling dizzy, shaky, or sweaty. Depression across the world affects children and teens with epilepsy. In the United States, depression in teens with epilepsy ranges between 8 to 35% and is higher than the general population of the same age. The risk of depression becomes more difficult when the teen has lower cognitive functioning, language disorders, and lower scores in specific neuropsychological domains. Age seems to be the least involved in the development of depression. In adolescents with epilepsy, depression could interfere with the overall management and quality of life, leading to poor scholar and social functioning, as well as increased healthcare system requirements, poor seizure control, and increased anti-epileptic drugs. Adverse effects. Therefore, comorbid depressive disturbances represent a heavier burden of the disease, particularly at this age. The issue of how children who have epilepsy feel about themselves and how they get along with others is not completely understood. Some studies suggest that children with epilepsy might have lower self-esteem because of their disorder. Other studies show that children with epilepsy have poorer self-concepts than children with other chronic medical conditions and frequently struggle in school and other social settings. These experiences might lead to poor self-esteem and symptoms of depression. Depression is underdiagnosed and inadequately treated, particularly during adolescence. In a study of the increased rate of self-reported symptoms of anxiety and depression, no patient out of 42 pediatric patients ranging from 7 to 18 years were diagnosed with anxiety or depression. However, 26% of the patients had exceeded the clinically significant cutoff point for increased self-reported depression. This suggests, with the lack of other previously published information, that such symptoms may be poorly recognized in pediatric patients with epilepsy. Furthermore, if healthcare providers do not inquire directly about potential depressive or anxiety-related symptoms, such symptoms may not be detected. To see if a teen with epilepsy has depression, some important symptoms observed are problems falling asleep, staying asleep, sleeping too much, changes in appetite, greater sensitivity to rejection, poor self-esteem, hopeless thoughts, thoughts of suicide, irritability, temporal lobectomy, a surgical to remove part of the temporal lobe of the brain, developing epilepsy early in life, tendency to be impulsive, having outbursts or violent behavior. Teens with epilepsy risk having suicidal tendencies. Risk factors include mood disorders, such as major depressive disorder and bipolar disorder, psychotic disorders, personality disorders, substance abuse, earlier suicide attempts, history of suicide attempts or completed suicides in family, critical life events or crisis. Additional risks include early onset epilepsy, has seizures frequently, or is on 2 or more anti-epileptic medications. Cognitive behavioral therapy, or CBT, is appropriate for children who are approaching the teen years and who can think about themselves and their relationships with others and with their illness. CBT helps the child interpret and change the negative thoughts that sometimes pile on when things are not going well. CBT can be very effective. It takes the expertise of a behavioral health specialist who can coach the child to learn and practice strategies that help to improve mood. It also takes the family and the patient to practice these techniques. In conclusion, depression affects teens and children of all ages with epilepsy more than the general population. The risk of depression affects teens with epilepsy more if diagnosed with low cognitive functioning, language disorders, and low scores in neurophysiological domains. It affects their ability at school and socializing in other social settings. It affects the self-esteem in their disability and themselves. Healthcare providers need to do more to address and notice these causes in depression in teens with epilepsy. Appropriate treatment could be cognitive behavioral therapy for teens. To learn more about depression in teens with epilepsy, please check out the resources used in the presentation today. Please like and subscribe to our YouTube channel and follow us on our social media pages. We would love to hear from you. Leave a comment below or email us at info@defeatingepilepsy.org. Thank you for your support, and together we will defeat epilepsy. Check out our other great videos and subscribe today. You have the power to defeat epilepsy.